Hello and welcome to Health Watch, a collaboration between Reuters and the Harvard School of Public Health. I'm your host, David Morgan, healthcare policy correspondent for Reuters in Washington. And with me today is Dr. Paul Biddinger of the Massachusetts General Hospital in Boston and the Harvard School of Public Health. Dr. Biddinger is a leading expert on public health and emergency preparedness, and he's here to talk to us today about Ebola in the United States. Hello, Dr. Biddinger. Welcome to Health Watch.
Thank you so much.
Questions have arisen about the credibility of state and federal policies and the readiness of the U.S. healthcare system to deal with Ebola as the U.S. government ramps up its response in West Africa. Many of those health workers will be U.S.-based, and none of that takes into account up to 4,000 U.S. troops that will also be heading to the region. What this means is that over the coming months, lots of people will be returning to the United States from the three countries that are affected by Ebola, and some of them, like Dr. Craig Spencer of New York, may be infected with the virus, while others, like Nurse Casey Hickox, will not be infected. So my first question to you, Doctor, is this. How well prepared is the U.S. health system to deal with Ebola after the missteps in Dallas, where Thomas Eric Duncan of Liberia died and two of his nurses became infected?
Well, I think it's very important to note that really Ebola and caring for a patient with Ebola is different than anything else that we do in healthcare in the United States. Since Ebola really got on the radar screen of U.S. hospitals over the summer and early fall, I think we've made tremendous strides moving forward in recognizing what's the correct personal protective equipment, and then there's been a lot of movement forward to select or identify teams within hospitals and sometimes even hospitals themselves that are capable of doing this to perfection, and recognizing when that's not possible that the patient needs to be transferred into a different setting.
Do you think the federal government and the Centers for Disease Control and Prevention specifically face a serious credibility problem, or is what we're seeing more likely to be a phantom of election politics?
I think what we're seeing is that federal officials and other health officials have been trying very hard to apply the science and encourage people to rely on science when guiding treatment. As we learn lessons, as happens in any new kind of an outbreak, we need to change guidance, we need to change planning. What I think is so hard is that the fear is driving non-science-based policies, such as the involuntary quarantine policies that are proposed for asymptomatic individuals. And what I do think the federal government needs to continue to do, as they have done, is rely on science to drive policy, not politics.
What do you think is at the roots of the credibility issues that U.S. public health officials are now having to deal with?
I think that the challenge is that they have a very fine line to walk with the messaging with respect to Ebola. So I think maybe early on our messaging of trying to reassure people that we know this is a bloodborne and fluid-borne disease that's spread by contact, and that every hospital should have mechanisms in place to prevent diseases spread by contact was maybe a little overly reassuring, making parallels to other bloodborne diseases that don't fully hold up. I think we still need to make sure that hospitals do take the responsibility of caring for an Ebola patient initially very seriously and do continue to make plans. However, I think we do have to recognize that ongoing care of an Ebola patient requires specialized teams that have had extensive training and practice and have very special protocols in place to be able to do that safely.
Once thousands of U.S. health workers and troops start circulating through West Africa and returning to the United States, do you think there will be enough facilities and enough beds to handle a worst-case scenario for Ebola infection?
Well, I think thankfully every day we are improving what we're doing in West Africa to make the worst-case scenario less and less bad. And what I mean by that is that we are improving our protocols for personal protective equipment donning and doffing in Africa. We're improving our monitoring, and every day the risks to healthcare workers go down. They may not be zero, and they probably sadly will never be zero, but the risks of seeing transmission to a healthcare worker as we build better facilities, as we have better access to more and specialized equipment and better protocols, should go down. Across the nation, we have been identifying hospitals that can take care of an Ebola patient. And as you know, in West Africa, the U.S. military is indeed building a hospital to be able to deliver U.S. quality tertiary care to anyone who might become sick with Ebola there and therefore not need overseas repatriation. So I do think we have good capacity at this time, and I am immensely hopeful and certainly praying for the fact that we don't actually need that level of capacity with ill healthcare workers.
You mentioned the patchwork of quarantine policies that has begun to emerge across the country. What effect is that likely to have on readiness to deal with Ebola at home and the ability to deal with Ebola in West Africa?
Well, I think it's so important to, again, rely on science. What we don't want to do is stigmatize healthcare workers who heroically are putting their lives on the line to care for those who are in most need in West Africa right now. And even as we have healthcare workers here in the United States who've been caring for Ebola patients, we've seen tremendous cases of stigmatization and some prejudice against those healthcare workers. I think we have to back off of politically driven policies. I think we have to stick to science. And otherwise what we're going to end up with is a circumstance where fewer and fewer healthcare workers are willing and able to take care of those who most need care.
Well, thank you, Dr. Biddinger, for helping us to better understand this complex and very important topic. Thanks also to our viewers for tuning in to this edition of Health Watch. I'm David Morgan. See you next time.